Just so you know, I am in the comment section for 1 hour at the launch of every YouTube video. So when you subscribe, make sure you hit that notification bell too, so you can come and ask me your questions. If you do want to learn more about skincare, you can get your hands on a copy of Skin Revolution. It's a book that I've written with HarperCollins. You can buy it from Amazon. Also, you can follow me on Instagram. I've got 2 accounts, Dr. Vanita Rattan, Skincare by Dr. V, and also on TikTok too. So I'm teaching skincare everywhere on pretty much all the platforms. So let's start with the symptoms. You can have hair loss just on the head or the entire body. Hair loss can be temporary or permanent. Common conditions could be hereditary, hormonal, normal aging, or medication. So let's go through the different hair loss patterns to see which one is more applicable for you. The most common is actually just thinning at the top of the head, and this happens with age. For men, it tends to be a receding hairline, and for females, you tend to see it as where your hair normally parts, it starts to broaden. Another common presentation is a patchy bald spot, and it can happen on the head, it can happen on the eyebrows or on the beard, and the skin can feel itchy. The next presentation is sudden overall hair loss, and it usually happens after a traumatic event, so an emotional event, or actually after a severe illness. So for example, if you've had COVID, you may have noticed a lot of hair loss. Right down below, yes, if that's something that you have experienced, because you're not alone, and it's not the COVID that actually led to the hair loss itself. It was just the chronic illness and the toll that it takes on your body. The good news is, in these cases, thinning of hair is temporary and it tends to grow back. The next one is full hair loss, which happens after treatments such as chemotherapy. Once the chemotherapy stops, hair often grows back pretty much similar, or a bit thinner. The next common presentation is patchy hair loss across the scalp with itching and oozing and redness. So that tends to be a sign of ringworm. So if you see any of these different hair loss presentations and it's distressing you, it is worth visiting your doctor. So we normally lose about 50 to 100 hairs a day, all of us. However, it's not really noticeable because you're continuously growing more hair too. When you notice hair loss, it tends to be actually after you've washed your hair and you've used conditioner. After you've used conditioner, slip increases. So the force required reduces when you're combing your hair. And so any hair that's shed but just sort of stuck in your hair will fall out at that point. So you're probably not going to notice it all day long, your hair shedding everywhere. You tend to notice it actually after you've used conditioner. So the other question I get asked is, Dr. V, does washing my hair lead to hair fall? And the answer is no. It's just that that's when you're noticing it more, because you've now got silicones in your conditioner, which is leading to increased slip, and it's just allowing the hair that's shed to fall out. So what are the causes of hair loss? So if you see a hereditary hair loss that happens with age, the receding hairline and thinning at the top, that's called androgenic alopecia. That's very, very common. The next one is that we're going to talk about is hormonal or medical. And so pregnancy, menopause, or thyroid conditions can all lead to hair thinning. Alopecia areata is immune system related and can also lead to patchy hair loss. Scalp infections such as ringworm will lead to the patchy hair that we've already discussed, and trichotillomania, where you're pulling the hair, is a disorder that can also lead to hair loss. Now, one of the side effects from a lot of medication actually is hair loss, not just chemotherapy. It's also for medication for depression, arthritis, increased blood pressure, and heart disease. The next one is radiation to the scalp can lead to hair loss. And then the next one is traction alopecia, where you have very tight hairstyles, so ponytails or cornrows that are pulling on the scalp, and that leads to hair loss at the front line. I'm not a fan of chemical treatment for hair. I've done it myself. I've chemically relaxed my hair, etc. But it can burn the scalp, and then that leads to scarring, and it leads to hair loss. Additional risk factors would be drastic weight loss or poor nutrition. So those are additional things that can lead to hair thinning. Now, baldness or thinning at the top of the head tends to be genetic, but there are a few things you can do to help. Starting off with prevention. So number one is you want a healthy scalp. Healthy scalp equals healthy hair. This means that with your shampoo, make sure it's fragrance free. You don't want any contact dermatitis. You want to use ingredients such as niacinamide actually in your shampoo and humectants and anti-inflammatories. So you want a shampoo that's basically going to nurture the scalp skin, because a healthy scalp equals healthy hair. You also want your shampoo to contain hydrolyzed proteins, so basically different molecular weight proteins. So small ones go into the hair shaft to make it thicker, and actually you can increase the diameter of your hair shaft by 10% with proteins. And then larger proteins on the outside to help repair the cuticle. So whichever one you want to use is fine. This is the one that I've made, and this is the thickening shampoo, which has all the ingredients that we just discussed to give you a healthy scalp and thicker hair. The next thing I would say is you want to make detangling easy. The more force you use when you are combing and brushing your hair, the more damage that's done, the more negative charge that's building up on your hair from damaged hair. And that then leads to static and further damage. A lot of damage happens to the hair when you remove the outer lipid layer, the 18 MEA lipid layer that protects the hair shaft and gives it its hydrophobicity, meaning you want water basically to bounce off the hair, not be absorbed into the hair, because once the hair strand swells up to 30%, it's fine, but between 30 to 70%, you now damage the hair permanently, and 80% plus, the hair starts to fracture. So to a certain extent, you want to make sure that that lipid layer is intact on the hair shaft. This gets damaged from chemical treatments, from heat styling, from products that are too harsh for the hair, and also environmental factors too. So with your conditioner, you want a very fatty conditioner. So you want to be able to basically do this to your conditioner. You want to be able to put your hand upside down with it, so you know it's got a high fat content. And so this is a cuticle repair conditioner that again is part of the Dr. Vanita Rattan range. You don't have to use this one. It's just I'm teaching you what to look for in your conditioner. Heat protectant oils are also important, and if you use the wrong oil, you're actually going to fry your hair when you put heat on it. So you want one that's specifically formulated to protect you from heat damage. So this is the one that I've made for my hair. This is the strand strengthening oil. You literally just put on one pump onto the hair like this and rub it in, and you start from the ends and you work your way back up. This protects your hair from UV damage, but also from heat as well. Ideally, I don't want you using any heat. That's the dream. And today I've decided just to go natural, and I'm probably going to do more natural videos because I actually don't want to damage my hair, and I don't want to put heat on it every week if I can avoid it. I know in the winter, in the summer, we feel more free to be able to do the whole curly hair, messy vibe, and then wintertime we feel like this is a very summer look. But I've decided that I'm gonna this is how I'm gonna go out in the evenings from now on. I just want to have my beautiful curly hair and celebrate it and stop straightening it every 5 seconds. That's not to say I will sometimes use heat, but ideally I want to move more in this direction and just normalize having your normal curly hair on a night out. Also limit tension on your hair. So limit braiding, limit hair bands, tight hairstyles, because we want to avoid traction alopecia at the front of the hair. I would say protect your scalp from UV damage by using caps. That is your friend. And you want to minimize dandruff actually. So dandruff is an increase of a microbe called Malassezia. Malassezia feeds on oil. So can you imagine on your scalp, you have between 90,000 to 120,000 hair follicles, and each of them are producing a little oil pots on your scalp. And so Malassezia is feeding on it. And you have those people who have dandruff have 10 times as much Malassezia as those who don't have dandruff. Now, 50 to 70% of the population have dandruff. If you have dandruff, it's an unhealthy scalp, and that leads to brittle hair that breaks quickly. So it may even be that your hair is breaking very quickly near the scalp, and that's why you don't see it growing thick or long. It's also the reason I tell you not to put hair oil on your scalp. Hair oil is for the hair only, not for the scalp. If it was oil on any other part of your body to hydrate the skin, trap water, reduce transepidermal water loss, I'd say yes, do it. But because of the situation with Malassezia on the scalp, I just wouldn't go down this vicious cycle of give them oil, Malassezia increases, scalp feels dry, let me put more oil on, and now you're in this vicious cycle. In addition, we lose 1% collagen every year from 21 years old onwards. And collagen is the most abundant protein in the body. It's needed for your hair, skin, nails, joints, ligaments, bones. And as we get older, we aren't producing as much collagen. Then once you hit menopause, you actually lose 30% collagen in the first 5 years after menopause. And so you see a drastic increased number of fine lines, skin starts to feel thinner, you bruise easier, hair starts to fall out, hair gets thinner. And that's one of the reasons why, which is why I encourage you to ingest collagen, drink collagen. You can get collagen from your diet, but most of us actually don't eat high collagen food. Collagen comes from joints, it comes from bone. So unless you're eating bone and cartilage of bone, which is what we don't tend to do now, or organs, we don't tend to eat that anymore. Now we eat, chicken breast, or we eat fish fillet, or we eat ground beef or ground mince, whatever you want. And that's not where the collagen is. The collagen is in the skin, which is, part of the meat that we don't, eat as much because it's not considered as healthy. For that reason, it's ideal to top it up with drinking collagen. Now, when you go for collagen, look for 8 grams of marine collagen. That's a bare minimum. Ideally, you want vitamin C in it too, because don't forget, you can't manufacture collagen unless you've got vitamin C. Plus, you want hyaluronic acid to really plump up the skin. And if you've got skin of color, you live in a cold country, opt for one with vitamin D in it, because we have lower vitamin D because of melanin in our skin, and so then that affects our mood and our bones. So whichever collagen you want to use is absolutely fine. This is the one that I have made for my skin of color family. It's the one that I take because it's got your 8 grams marine collagen plus all the other nutrients that we require. So the next thing I want to talk about is micronutrients to the scalp. So with age, we have reduced blood flow to the scalp and reduced micronutrients getting to the follicles. And so this also contributes to hair loss and slower hair growth. So one professional growth treatment you could do is PRP. It does have side effects, so do look into it. It is very painful. It's 100 injections, but it is effective. You do have to keep up with it, however, because otherwise your hair will fall out. But there are some side effects with PRP, such as inflammation of the scalp, irritation. If you react, it can lead to scarring. So there are side effects with it, but it is an effective treatment if you are desperate and it's really affecting your quality of life. Now, there are 4 phases when it comes to hair growth. Anagen, which is the growth phase, catagen, which is the transition phase, telogen, which is the resting phase, and exogen, which is the shedding phase. So I've created Anagen Boost Tonic for you, so water-based tonic to keep your hair in the growth phase for longer. It works on DHT modulation by inhibiting 5-alpha reductase. I put in calcium gluconate in order to reduce inflammation, and I've also put in arginine to increase blood flow to the scalp. Don't forget, I'm in the comment section for 1 hour at the launch of every single video, so make sure you subscribe and hit that notification bell, and I will see you later. Take care. Bye.